Hi everybody, Dr. Robin here from Grand River Eye Care. In this video, I want to talk about dry eye syndrome, and in particular about some of the newest technologies that we've got where we are able to treat the underlying cause of our dry eyes, rather than just treating some of the symptoms like we used to with artificial teardrops or with warm cloth compresses. It's really exciting technology. Come take a look. So let's talk about this new treatment, what's all involved, and how it can be used to regenerate some of our tears naturally. In an eye exam, we are now able to image, with a special infrared camera, the glands that are responsible for healthy, oily tear production called the meibomian glands. Meibomian gland dysfunction is a leading cause of dry eye disease, and it just gets worse with time. What we're looking for in these images, if things are healthy, are between 60 and 80 glands that run the length of the upper and lower lids parallel to one another. They secrete a bit of oil onto the front surface of the eyes every time we blink. With meibomian gland dysfunction, the glands start to degenerate and can even die away with time, leaving us with less than adequate number of glands. In addition, the glands start to produce an oil that's like a thick toothpaste consistency, rather than a nice, thin, healthy olive oil consistency. An infection inside one of the meibomian glands is what we call a stye or a chalazion. Our goal when treating this disease is to regenerate the glands that we still have and to make them more functional so they produce the right kind of tear to keep our eyes lubricated. At first, we have our patients reclined and we instill some freezing drops to make the patient more comfortable. Next, a protective contact lens shield is placed into the eye that protects the eye itself from excessive heat. We then apply ultrasound gel to the lid before treatment. Next, heat is applied via radio frequency, one lid at a time. Once a desired temperature is reached, we stop heat application and manually express the meibomian glands. Heat is applied an additional 2 times. The temperatures we aim for are 38, 39, and then 40 degrees Celsius. Stopping each time to express the glands and try to empty out the bad, pasty contents. Next, we move on to the bottom lid and repeat the process. We will then remove the shield and carry on to the second eye. This is a safe and effective treatment for dry eye syndrome and meibomian gland dysfunction with no downtime. Patients will experience some relief after the first treatment. What we recommend is 3 treatments spaced 1 month apart to give us the more long-lasting effect. There are a few contraindications. For example, patients with pacemakers should not have radiofrequency treatment. Finally, we have a therapy that can treat the actual underlying cause of dry eye syndrome and meibomian gland dysfunction, and not just mask the symptoms. Say goodbye to dry eye.